Scheduling your surgery will be done through our surgery coordinator, who will make every effort to accommodate your scheduling request. It's important to note, however, that we will not schedule the exact time for your surgery until the day prior to the surgery date. Also, children and patients with certain health problems may need to have their surgery early in the day. At your preoperative appointment, our medical staff will obtain a medical history and perform a physical examination. Please bring an updated and complete list of all prescriptions and over-the-counter medications you're taking to the appointment. We'll need to know about any allergies you have, including latex, and also any metal allergies, especially if your surgery requires the use of pins, plates, or screws. If you're in need of any preoperative lab tests, we will arrange to have them completed at least 3 days prior to your surgery. Please have copies of any x-rays and blood work done in the past 6 months faxed to your scheduler. It's also important not to schedule any elective surgery, including any type of dental work, to be done 72 hours prior to your surgery or 2 weeks after to avoid infection. If you're currently taking any heart, blood pressure, gastric reflux, or thyroid medication, and you normally take them in the morning, take your usual dosage the morning of the surgery with a small sip of water. The anesthesiologist will typically try to contact you the night before surgery to discuss your medical and medication history. If you're diabetic, the anesthesiologist will explain what medication, if any, you can take the morning prior to surgery. If you take blood-thinning medications due to cardiac or vascular problems, we must be informed of this prior to the surgery day. You'll be given a prescription for a narcotic pain medication on the day of surgery. There's often a refill allowed for this medication. Prior to your surgery, there are several precautions we require for your safety and comfort, including the removal of artificial fingernail tips or polish. Also, many times, our postoperative dressings and splints are bulky, so we ask you to wear clothes with large sleeves. For the surgery itself, you'll be required to wear a hospital gown. You will not be allowed to wear any jewelry during surgery, including any body piercings. Do not shave or use hair remover on the area being operated on, as this can irritate your skin, which increases your chance for postoperative infection. We normally tell our patients not to eat, drink, or smoke after midnight the night before surgery. If a patient is scheduled for a later time in the day, the anesthesiologist will decide the time when the patient should stop eating and drinking clear liquids. Since smoking decreases your body's ability to deal with your anesthesia and your body's ability to heal after surgery, we ask you to avoid smoking both prior to and after your surgical procedure. We normally place people in a postoperative plaster splint to allow for swelling, rather than a traditional cast. We do not remove the dressing or splint or allow it to get wet until we see you for the first postoperative visit. If the dressing becomes too tight due to swelling, contact us and we'll tell you how to relieve this. During the first 48 to 72 hours, you must elevate your extremity above the level of your heart. If you're in a reclining position, you need to place your extremity above the level of your chest. If you're standing, place the surgical site as high up on your chest as possible. Use ice packs for prevention of swelling during the first 48 to 72 hours following surgery. And protect your splint from unnecessary moisture or leaks produced by the ice packs. Occasionally, following general anesthesia, people develop a low-grade fever, normally below 102 degrees. Continue to take the pain medication as prescribed. This medicine usually has a large quantity of the medication that's in Tylenol, which will help lower your fever. Also, because the medication prescribed for use following surgery is a narcotic, we want you to discontinue it as soon as possible following surgery. It was prescribed as a postoperative medication only to help you deal with the pain. Normally, you should be able to return to work within 2 to 5 days following surgery. If your job is physically intensive, we ask that you speak with your employer about finding a reduced labor-intensive position for a given period of time. Texas state law determines when you'll be able to return to driving. The law states that the operator of a vehicle must have the use of both arms and both legs in order to safely operate a vehicle. After scheduling your surgery, you'll be scheduled a date and time for your first postoperative appointment. This visit may consist of removing dressings, removing sutures, and applying a splint or cast. If you have a fracture, repeat x-rays may be needed.